Hey everybody, Woody here. Today we're going to be doing a quick little instructional video on how to place on a Pro Step walker or a cam walking boot, depending on who you're ordering it from. This is meant to take the place of a cast, or if an injury or a sprain doesn't dictate a cast, we can suffice with a boot. The boot has a rigid frame with a soft interior. 5 straps, most of them have 5 straps. Sometimes that can vary depending on the brand. 2 on the bottom and 3 on the top. And it has a rocker bottom, which I'll show you here. It has a rocker bottom to allow the heel to toe movement without having to move the ankle, or if there's a suspected injury at the foot, so you don't get that foot crease in the toes. Pretty simple to put on. For time purposes, I already had loosened up all the straps already. You open up all 5 of the straps. The 2 straps on the bottom are fixed, and you open up the other 3 straps. Then you open up the vest of the boot. Comes with a little handout you can give the parents. Some of the boots will come with extra pads on the inside that you can place in various spots wherever there's a gap. Other boots, like this one, will have pads already placed in it, which I will show you. This one has a pad sewn in right where the crease of the foot would be. This pad's going to rest over the crease, and it also has 2 pockets, a medial and a lateral pocket, where it has 2 pads placed in just like so. And those will rest to comfort the inside and the outside of the ankle, the medial and lateral malleolus. So we'll go ahead and place that on and do a quick little demo here. If the patient is wearing loose pants and they'd rather tuck the boot under the pant, that's acceptable. If you have somebody who's wearing tight jeans or yoga pants or something of that nature, you would just put it over the top of those pants. If they're wearing shorts or a skirt, you want to advise them to probably wear a longer sock or some kind of hosiery, just because the material on the inside can get a little bit irritating depending on how hot and humid it is outside. So you put their foot in, you get it rested nice and snug in there between the 2 pads. Make sure the toes don't hang over the lip. You place this pad over the crease for comfort. You close the first flap and you Velcro it just like so. It doesn't have to be super tight, just nice and comfortable, nice and snug. Try to get rid of all the wrinkles. Then you place the other pad around the tib fib, just like so. Just tuck it in and Velcro it nice and comfortable. And then you go ahead and place the straps. The straps usually have a pretty strong Velcro on them. You bring them around. Out of habit, I tend to do the 2 lower ones first. I like to do this one here by the crease of the foot, because as you place it in with just a little bit of a tug, it kind of locks the foot into the boot without you having to do a lot of shifting as you're working your way up or down. And then you go ahead and do the rest of the straps. We'll do those kind of promptly here so that we can do a little demo how it's gonna work when you walk on it. And these straps go through the buckle. They come all the way around and they Velcro. And for whatever reason you have little flaps hanging, you can trim those as needed, just like so. Sometimes the MD will prescribe one of these after a cast if they feel that they need a little bit more assistance before they go directly back into walking after the cast removal. That's how you place on the Pro Step walker, or cam boot if you will. I will go ahead and have the patient hand the camera to me, and we will have that individual walk for us. You can see how he's doing a heel to toe walk. And that is the Pro Step walker. All right, you guys, thanks very much. You guys have a good day, and please feel free to put in the comments anything at all that you guys can think about as far as other items you want us to do videos on. Thanks, Tony.